Hi, everyone, and welcome. Thanks for coming to Ask Me Anything Insomnia and Sleep Problems. We're going to get started here and look for some questions. Let's see. Oh, here's one. I've heard it said that therapy for treating sleep issues should be the therapy before all other therapies. What does that mean for clinicians? What a great question. Um, okay, so not all therapies are created equal when it comes to insomnia disorder. I think talking to somebody about sleep problems is always helpful. But if you have insomnia disorder, as in you have chronic insomnia, half the nights of the week you are struggling to be able to sleep, and it's been going on for months and months and months, then really cognitive behavior therapy is the therapy before all therapies. And what they mean by this is that this is a therapy that was researched, tried and true, looking for what are the causes for a chronic insomnia. Not what causes having a bad night's sleep. All of us have that, right? It's what happens when it becomes chronic, because there are three specific things that happen, and you will need a therapy that has researched that and found ways to address those three causal factors. So, cognitive behavior therapy is the therapy that's considered the frontline treatment for treating insomnia disorder. And if you join myself and Dr. Meg Danforth in a few months for our Insomnia and Sleep Problems online training course, you can also see that you can register today if you wanted to by clicking on that QR code or going to pessy.com/Carney. We're going to go over what is CBT, cognitive behavior therapy, and what are those three causes. All right, let's see if there's another question here. Oh, I mean, what is CBT in a nutshell? Okay, in a nutshell, I'm going to say it's three or four main things. But I guess the main thing it's doing is based on that research about what causes chronic insomnia. It leverages a couple of your sleep systems to provide relief from insomnia disorder. The two main sleep systems it's going to leverage are one is a system that makes up for lost sleep. So it's going to increase your drive for deep sleep, which is going to quiet your mind and make you fall asleep more quickly. It's also going to leverage your body clock. Your body clock is something that regulates many different things in your body. If you provide regular input into it and sort of the come up with a schedule that's best for you, you're going to be able to wake up more easily and go to sleep more easily. So it's going to leverage that system. I'd say the third thing it's doing is it's getting rid of the association, the new association that you have with your bed and being awake. So if you've ever had the situation where you get into bed and you are wide awake, a second before you were sleepy and you get into bed, boom, wide awake, or the light goes off and wide awake. It means that unfortunately, unbeknownst to you and no fault of your own, your bed has been associated with wakefulness. So you're going to need a new association with that bed and only sleep. And so there's some things you can follow for a couple of weeks to get rid of it. And then I would say the last thing that we do in CBT is actually take a look at the way that you think about and feel about sleep. And if there's anything that's getting in the way of you following these recommendations that would leverage those sleep systems and make that new association, then we're going to try and address that. If you believe that we always need 8 hours or else, you may have difficulty following the instructions for that therapy. And we will teach you about myths about sleep. And one of them is that you need 8 hours. The truth is that anybody who's listening right now, if I asked you to get 8 hours of sleep, some of you would develop insomnia because you never would be able to sleep 8 hours. You're less than that. You're maybe a 7 hour sleeper or even a 6.5 hour sleeper. Some of you would become sleep deprived because you're actually greater than an 8 hour sleeper. You have sleep needs that are longer than that. So the 8 hour is a bit of a myth. How much sleep we need really depends on changes on a daily basis. So these are some of the things that you're going to learn in our training. Okay, let's see if there's anything else here. What are the 3 Ps of sleep disturbance? The 3 Ps. Okay. So the 3 Ps are what we in sleep medicine refer to as those three causal factors. Those three things that show up again and again in chronic insomnia, not occasional insomnia that we all have. The 3 Ps are that there are certain predisposing factors that we all have to some extent. And people with chronic insomnia tend to have them to a greater degree. So a predisposing factor may be, you may be somebody who's a night owl. If you are a night owl and you have to get up early for bed, or you have other sort of challenges, then you may be more predisposed to developing insomnia because the environment, um, especially in Western culture, has this sort of unfair bias towards night owls. So that's kind of tricky. The second P is a precipitant. That is a fancy way of saying a stressor. All right, we all have those. It can even be a positive stressor. So you may be somebody who's a night owl, and then you have a stressor. What about it's positive? You're excited about something, and so it takes you longer to fall asleep. Okay, those two things in and of itself are not going to cause chronic insomnia. What takes over is the third P, which is the perpetuating factor. And if a perpetuating factor is there, that's when we get into trouble, and that's when it becomes more of a diagnostic situation. Okay, a perpetuating factor is something like the pairing of the bed with wakefulness. Okay, are you somebody that does a lot of wakeful things in bed? If you do, the difficulty in that is that the bed may become paired outside of your awareness with being awake. And so the 3 Ps are things that we will look at for each individual person to see what can we target, what can we do to make this, to help this person sleep better. And that's something that you'll learn about in the talk. Sleep restriction therapy. Oh, okay. Sleep restriction therapy is probably the most poorly named therapy I've ever seen. It makes it seem like we're restricting sleep. If that was the case, I don't think anyone would do it. It's actually time in bed restriction. And what we do is, in order to leverage the system that makes up for lost sleep, we trick it essentially by spending less time in bed in a 24-hour period to send it a message that you actually require more deep sleep to recover. And so what we do is we will look at your sleep over the course of a week or two and analyze it and figure out what is the optimal amount of time for you to spend in bed that would actually increase the drive for deep sleep and allow you to recover. And it would send a message to this system, oh, you need more deep sleep. Got it. And so we leverage that system. Once that works, what usually happens is that people with insomnia actually increase their sleep drive and are able to fall asleep more quickly and sometimes even longer. And in some cases, their need for sleep actually increases. So then we do the second part of sleep restriction, which is sleep extension. And then we would change that schedule to actually include greater amounts of time in bed. So you will learn all about these things if you're able to join myself and Dr. Danforth for that online training course. Stimulus control. The question is about stimulus control from the brochure. Stimulus control, there are two main big hitter tools in CBT for insomnia, or CBT-I. One is the sleep restriction therapy, which really should be called time in bed restriction. And then the other one is called stimulus control. Stimulus control is a treatment that gets rid of that association of the bed with wakefulness. So remember a second ago I talked about if you're somebody who feels like they're able to sleep, then you might even be falling asleep on the couch. And then you go up, you get into bed, and boom, a switch goes off and you're wide awake. If that sounds familiar to you, you have something called conditioned arousal. And this treatment right here, stimulus control, is actually the treatment to get rid of it. So, it's in a nutshell, it says that you should only be in your bed when you're asleep or pretty close to it, which is kind of a vague piece of advice, isn't it? So, stimulus control actually contains 5 rules that are meant to help you with reassociating the bed with sleep. So the first thing that's going to happen is you're going to wait longer to fall asleep. And the reason why you're going to, or sorry, to go to bed, and the reason why you're going to do that is you want to generate some sleepiness. And so you're going to wait until you're actively falling asleep, like the person in my previous example just did. But then if you get into bed and that switch goes off, you are now not in the position where you're going to fall asleep quickly. And so it's time to get out of bed and go back to the couch and do what you were doing before, so until that feeling comes back again. And repeat it a few more times until you get to the point where you really will fall asleep. I think the mistake people make is that when they get into bed, when they're sleepy and that switch goes off, they lay there frustrated, trying harder to sleep. And trying harder is not the solution. Most people with insomnia try really hard. So it's not about effort. In fact, I think CBT-I is really about the release of effort. So in our workshop, we're going to teach you the 5 rules of stimulus control, which will include waiting until you're sleepy and then getting out of bed and waiting for sleepiness to come back, as a way of retraining your body. It's something that you have to do for about a week or 2. I think our last question is coming up. Oh my gosh, this is going by so quickly. Let's see what it is. Let me get rid of this. What are some non-environmental things that cause middle of the night awakenings? Wow. Obviously, there's lots of environmental ones, right? Like dogs barking and snoring, etc. A lot of the middle of the night awakenings are really related to what's happened during the day and scheduling. So, one very typical thing that will happen is sometimes people will go to bed too early. So they've not built up enough sleep drive, right? And then what will happen is they'll sleep for almost like a power nap at the beginning of the night, and then they'll wake up and they'll spend a good amount of time awake, not able to regain sleep. And it's because um, they don't have enough in the tank to carry them through through the night. So that's a major one that we see. Of course, chronic pain can lighten sleep. Substances can lighten sleep. Um, Sleep apnea, undiagnosed sleep apnea, um, can affect things. So there are lots of things that can wake you up in the middle of the night, but people make the mistake of thinking that waking up in the middle of the night is so different than having difficulty falling asleep, when really they're all the same things. Do you have enough deep sleep drive built up? We're going to teach you how to know if you do, and how to leverage that and increase it. Um, are you sleeping within an ideal sleep window? We're going to help you discover that. And do you have conditioned arousal? Are you somebody that when they wake up, they're wide awake? Whether it be when they get into bed or when they wake up in the middle of the night. And if any of those things apply to you and you've been suffering from insomnia chronically for a period of time, then CBT-I is going to help you get rid of that. And I think we're going to end there. Please join us. Please join myself and Dr. Meg Danforth. You can register right there at pesi.com/Carney, or use the QR code and register today. I hope to see you there. This is just a little sneak peek of what you'll get. You're going to get a lot more how to do each of these things. And I hope you